Hi everyone, my name is Dr. Salyards. I'm a board-certified dermatologist and I'm the owner and founder of Refine Dermatology in Knoxville, Tennessee. Today, I want to talk about a topic that's incredibly important for long-term skin health. This is the different types of skin cancer and treatment options that are available for each. Skin cancer is the most common cancer in the United States, but when it's detected early, it's also one of the most treatable. So let's walk through the main types of skin cancer, what they typically look like, and how we can manage them. The most common type of skin cancer is basal cell carcinoma. It often starts like a pearly bump, a pink spot that slowly enlarges, or just a sore that won't heal. Basal cells rarely spread to other parts of the body, but they can continue to grow locally and cause significant damage if they're not treated. Treatment options depend on the size, depth, and location of the lesion. Surgical excision is one of the most common approaches and involves removing the cancer along with a margin of healthy skin. Mohs surgery is a tissue-sparing technique, and this is used for high-risk or cosmetically sensitive areas like the nose, eyelids, or ears. It allows us to remove the cancer layer by layer, and this preserves as much normal skin as possible. And then for certain superficial basal cells, we might use something called ED&C, or electrodesiccation and curettage, and this involves where we just carefully scrape and cauterize the tissue. And then in select cases, topical medications like imiquimod can also be appropriate. The second most common type of skin cancer is squamous cell carcinoma. These look like scaly patches, rough or crusted bumps, or tender spots that might bleed. Squamous cell carcinoma carries a higher risk of spreading compared to basal cell, especially if the lesion is larger, rapidly growing, or located in a high-risk area like the lips or the ears. Treatment varies depending on the tumor's features, and surgical excision is frequently the first-line treatment. Mohs surgery is also recommended in this situation for higher risk tumors or those that are in cosmetically sensitive locations. For early or more superficial squamous cells, that ED&C or topical therapies can also be appropriate. And then in more advanced cases, these might require radiation therapy or less commonly some systemic treatments in collaboration with oncology. Next, I'd like to discuss the most serious type of skin cancer, and that's melanoma. Melanoma often looks like a new or changing mole, especially one that's asymmetrical, has irregular borders, multiple colors, or it's growing. Because melanoma can spread quickly, early detection is absolutely critical. Treatment's going to be based largely on the stage of diagnosis. Early or more superficial melanomas are going to be treated with surgical excision, usually with a slightly wider margin of normal skin. Depending on the depth of melanoma, we might recommend a sentinel lymph node biopsy, which is going to help determine whether or not the cancer has begun to spread in your body. More advanced melanomas are treated with immunotherapy, targeted therapy, or radiation, often as part of a coordinated care plan with oncology specialists. Before we wrap up, I also want to mention actinic keratoses. These are going to be rough, scaly spots that are typically caused by cumulative sun damage, and they are considered precancerous. If left untreated, they can progress to squamous cell carcinoma. Treatment options for these include cryotherapy involving freezing the lesions with liquid nitrogen, topical medications like fluorouracil, or photodynamic therapy. And this is a light-based treatment that's designed to target the precancerous cells. Managing the AKs early is an important step in preventing future skin cancers. So in closing, while skin cancer is common, early detection and appropriate treatment make an enormous difference in outcomes. If you notice a new spot, a non-healing lesion, a changing mole, or anything that just simply doesn't look right, it's always best to get it checked. As a board-certified dermatologist, I'm here to guide you through screening, diagnosis, and treatment so you feel informed, supported, and empowered every step of the way. Thanks for watching, and stay tuned for next month.